Welcome to this video about neutropenic sepsis, previously known as febrile neutropenia. In this video, you will learn about what to do if your child is unwell or develops a temperature while at home. After watching this video, we hope you'll understand what neutropenia is and when your child is classified as neutropenic. We also hope that the information will help you understand what neutropenic sepsis is, how it is managed, and the actions you should take if your child becomes unwell at home. Some chemotherapy drugs can reduce the production of white blood cells by the bone marrow. This lowers your child's immunity and makes them more prone to infection. The risk of infection varies depending on the type of treatment your child is having, how low their blood counts are, and the length of time they are low. There are many types of white blood cells. One type is called neutrophils. When the neutrophil level in the blood is low, this is called neutropenia. Your child is neutropenic if their neutrophils are 0.5 or below. A full blood count, or FBC for short, is a blood test that gives numbers telling us whether they are normal, low, or high numbers of various blood cells, including neutrophils, in the blood. Neutropenic sepsis refers to a situation when your child is neutropenic with neutrophils of 0.5 or below, and they become unwell with infection. This may be associated with high temperatures of 38 degrees and above. However, your child can become unwell even without a high temperature. You will hear more about this later. Neutropenic sepsis is considered an emergency and must be dealt with immediately. The most important part of caring for your child during treatment is to seek advice immediately if they become unwell or develop a fever. If your child has a temperature of 38 degrees, please call your child's shared care hospital using the telephone number you have been given. Explain that your child is undergoing chemotherapy treatment and has a high temperature. Then take your child there immediately. In order to care for your child safely at home, it is very important to have a suitable thermometer available at home. This way, if your child seems unwell and/or feels hot, you can check their temperature. We recommend using a thermometer that is placed in your child's ear or under their arm. Mercury thermometers are no longer recommended for use with children, and forehead thermometers might not give an accurate reading. We advise that when your child is at home and develops a temperature, they should not be given paracetamol. This includes Calpol, until they are reviewed at their shared care hospital. Once your child has been reviewed at the hospital and it is clear what action is needed, paracetamol can be given. The use of ibuprofen, including Nurofen, is not advised while your child is receiving chemotherapy or radiotherapy, unless discussed and agreed with your child's named consultant at Great Ormond Street Hospital. Once your child has been admitted to hospital, they will be examined and will have some blood tests taken. This will include blood cultures. Your child will then be started on a course of antibiotics. While they are at the hospital, your child might also have other tests taken to look for different types of infections. For example, they might be asked to give a urine sample to look for a urine infection, or a nose swab to look for respiratory viruses. The length of stay in your shared care hospital will depend on how quickly your child's temperature settles, how well or unwell they are, and the type of infection they have. It is common that a source of infection may not be found. However, the antibiotics that will be given treat the most common bugs that cause infection. The doctors and nurses will be able to tell you about the tests they have done and the results. Whether or not your child is neutropenic, if you are concerned that they are unwell, seek an urgent review at your shared care hospital. Sometimes children can become unwell without having a high temperature. Your child may be drowsy or more tired than usual, have tummy pain, vomiting, or diarrhea. If this happens, telephone your shared care hospital as your child may need a medical review. This is very important, especially if your child has trisomy 21, also known as Down syndrome. Children with Down syndrome do not always develop a high temperature if they have an infection or are unwell. Please be aware, steroids such as dexamethasone, prednisolone, or hydrocortisone can mask a temperature. So if your child is taking steroids and seems generally unwell with it and may not have a temperature, please telephone your shared care hospital or community nurse for advice. These are the situations when paracetamol can be given at home. If your child's neutrophil count is 0.5, so they are not neutropenic, only if their temperature is below 38 degrees, only for mild or moderate pain, only if they are well in themselves. If you have any doubts or are unsure, do not give paracetamol and contact your shared care hospital for advice. Neutropenic sepsis is an emergency. It can be successfully treated with early antibiotic treatment. Your shared care hospital can review your child 24 hours a day, 7 days a week, 365 days of the year. Thank you for watching this video on neutropenic sepsis. We hope the information has helped and there are more videos to follow.